Welcome to Practical Talk Time. I'm your host, Usha Kumar. Today, I have an excellent topic, and this is about sexuality and its effect on your health. And I have a wonderful guest, Anita Boeninger. She is a founder of Sexuality Medicine Summit in New York, and she has come all the way here to explain what she does and how she helps the medical profession, the patients, and everybody else with integrative medicine and her knowledge of the relationship between sexuality and good health. So please join me in welcoming Anita. Anita, welcome to the show.
Thank you.
It is such a pleasure having you on this show.
Yeah, it's an honor to be here.
And thanks to Sandra, she found you, I guess. And this is a wonderful topic that we have not really covered in our show. We have had other programs when we talked about nutrition, holistic health, meditation, yoga, you name it, exercise. We've talked about so many things with the hope of keeping and maintaining good health. And we really didn't talk about sexuality and its influence on the health of a person.
Yeah.
So welcome to the show.
Thank you.
First, I want to know, ask you about your background. Where did you come from, and what did you have to train and to become what you are now?
Well, I started out in physics, and I became an astronaut, and then, no, I'm just kidding.
We've had those too on our show.
No, I'm just kidding. I began as a clinical social worker, and years ago. I first started out working with HIV-positive patients in Dallas, Texas. And then I worked with refugees. I worked in a lot of humanitarian organizations like Amnesty International. And through the process, started to learn more about alternative modalities like dance therapy, movement therapy, yoga, meditation, and other ways of healing besides the more conventional clinical therapeutic approach. So I started to go more and more in depth in every modality I could get my hands on. I pretty much studied and trained and certified and everything I could. And eventually found my way to NYU Hospital, where I worked with the patients there who were having surgery. I did hypnosis with them. I taught the staff.
Wait, you also trained on hypnosis?
I did, yeah.
What kind of hypnosis is that?
It's called medical or clinical hypnosis. So before surgery, I would lead the patients through an hour workshop where they learned how to deeply relax so they would heal better.
I see.
After their surgery. They would tend to use less pain medication and less anesthesia and heal faster. So through basically lots of different twists and turns, then I began my own practice about 2 years ago and started working more with women in particular, which women access the healthcare system in larger numbers anyway. So mostly women are dealing with chronic illness, autoimmune disease. And I started to observe the connection between autoimmune diseases and sexual health or issues surrounding sexuality. And that became more of my focus. So that's why I did the summit, the Sex and Medicine Summit, to connect the dots. Where the conversation is missing around sexuality as a major role, as a foundational part of our health.
Yeah, I think it's interesting that many surgeons around the country and around the world are now beginning to realize the importance of alternative therapy in healing faster and recovering quickly from surgeries, and also I think in preparing the patient for the surgery and to have a better mental state going into a surgery in order to have a better outcome. But then you've taken it another step more, right? And including this topic of sexuality, which is not being talked about. I'm just surprised that it's it's not being talked about as much as it should be.
Yeah,
So-
I am too, but that's, I think it's a taboo topic, and it's,
I think, it is a
it's
taboo
sensitive
topic in most countries around the world, most
Yeah.
Societies around the world.
Mm-hmm.
I know in mine, I think originally it was not a taboo subject, but then we had other rulers who brought in their Victorian system into our country.
Other
And then it became a
influences.
taboo topic, I think, after that.
Yeah.
So what has been your experience beginning, when you began
Well,
your practice here?
I started to observe that women, particularly I was working with women who have migraines and with neurological issues, so chronic
see.
headaches and insomnia and other things related to that.
So they are not
and-
hypochondriacs.
No.
As-
No, these were people who had 24 hours a day migraine headaches.
Yeah, and most doctors
chronic pain.
always diagnose them as hypochondriacs.
I don't know. I mean,
I
they
even
go
remember
through,
a doctor used to
Yeah.
say that, okay, I don't understand. This woman keeps coming to my office and she has this headache, migraine, and everything all the time. And she seems healthy otherwise.
yeah, I mean,
so he said, oh, she's a
it's
hypochondriac.
the
So that's not true, right? It's not
well,
just hypochondriac.
no.
They
I mean,
really have
there's something
these
going
headaches.
on,
Yeah,
and it could be diet or it could be other issues. So what I started to observe was also some of my clients or patients there was also sexual trauma in their history,
I see.
and there was a way that they were carrying themselves, and because I've trained a lot in watching people's movement
I see.
and reading people's bodies and seeing where they're holding patterns related to a trauma. It becomes very evident with training. And I could tell that these women were really suffering from that, but it wasn't something they were addressing with their doctor necessarily.
Oh.
They're being medicated, but these underlying foundational
So they are just
issues
being
were there.
medicated for their symptoms rather
Right.
than the real
Right.
cause.
And it's not to say that everyone with a migraine is somehow
Yeah.
sexually, has a sexual abuse history. But I did notice there was this parallel,
Okay.
and also with chronic illnesses and autoimmune diseases. So I became more curious about that and looking into the hormones, how the balance of the hormones can affect mental health. It can affect the immune system. It affects everything, essentially, our well-being in so many facets. So,
But then you only come across a certain number of people. Will that be enough statistics to call it a study?
well, I wasn't conducting research. I
Okay.
wasn't doing.
So it
any
was
kind
just
of
your
formal- It was my
observation.
own observation,
Okay.
and then I did the summit to actually find out more information from medical professionals and people who've done a lot more research in this field, or they're aware of the latest research.
I see.
And that's where it's like, yeah, this really does have a huge impact. Where how women in particular are connecting to their bodies, are befriending their own bodies, and taking time to really care for themselves, including making space in their lives for sexual expression. It seems to be the modern ailment that there's almost a disconnection from a healthy sex life. There's just all work. There's so much work and so much stress. And that does affect hormone balance. It can lead to adrenal fatigue for women, which can lead to many other problems.
So you only specialize in women's.
Mostly women is my
problems.
focus.
Okay.
I have worked with men as well.
Okay.
But statistically, 70% of people with autoimmune diseases are women.
Oh, really?
And
Okay.
it's about the same percentage of people who access health care in the hospital setting are also women. So it's women that are the focus of all these new drugs, of all these new studies, of things like hormone replacement therapies and all kinds of other.
So what is the
things.
age range that you're considering?
I would say I don't have a particular cap either direct. I mean, I don't see teenage women, girls,
Yeah.
but young women all the way up to women in their 70s and 80s sometimes.
Oh, really?
So, yeah, because we can all, I've had calls with women who are in their 70s and wanting to revitalize their sex life. And actually, where do they, asking me, where do I start? And how do I start dating again? If if their partner has passed away, then they still have this desire to live their life fully. So then it's a really big part of flourishing, I think.
And they want to do that because they want to feel healthier or feel...
I think they want to enjoy themselves. They want to live a full life. I think they wanted to still feel like a woman and feel feminine and share themselves that way.
I can see how that kind of relates to mental health, for a woman. But then what are the other areas of the body, like you mentioned about the immune system? And does it affect any other part?
Definitely. I mean, our endocrine system, the hormones in general affect our mood, can affect the immune system function. So if one thing is off, if we have too little production of estrogen or too much, I mean, I'm not a doctor, so I don't know all the extensive details, but in the broad sense of a lifestyle that is high stress, over time that will really start to wear down on the woman's body, which we all kind of know and hear about. But one of the avenues to making that more balanced is diet with sex hormones in mind. So as opposed to eating for just, I have to count my calories and I have to make sure I don't have too much starch, and it's looking at it, what will nourish and cultivate the reproductive system to be at its best, to be at its highest capacity.
And what are those foods?
Well, things, green leafy vegetables, which are high in folate and manganese, are great. Anything with vitamin A, the vitamin B complex, but some of those, and zinc as well. A lot of people, I'll just back up, one of the guest experts that I interviewed for the summit was a psychiatrist named Barbara Bartlick, who's in New York City, but she does an assessment of her patients first at the level of their micronutrients. So looking at where are they low in something or high in something, and a lot of times it's magnesium that's too low, and that affects sex hormone production, which affects a libido, it affects brain function, and all these, whether you're set up for a healthy, thriving life is synonymous with whether your body's fully producing sex hormones in a balanced way.
I see. I know, you're right. People are counting calories and cutting this and cutting that, and they're not really eating the right foods that the body needs. I know magnesium is found in even simple things like peanuts, right?
Yeah, and I believe walnuts, and there's many other vegetables too. I think taking foods that have a range of different nutrients, like kale. I mean, kale is more popular now, and there's ways to prepare it that really can be a huge boost in those necessary micronutrients to support the endocrine system. So all the drugs that are created to help women with their hormone system often can be counterproductive and not even necessary.
In your practice, like whatever you're trying to accomplish with alternative medicine, not quite medicine, right?
No, I'm not a doctor.
So
integrative health and education, some training, some coaching along with that.
So you do the training and coaching for patients?
For people a lot of times I work with people in healthcare.
Okay.
So nurses, doctors, social workers, physical therapists, because they're often running around taking care of everyone else and not taking care of their own bodies. And I see a lot, and you can also see there's a lot of depression, there's a lot of suicide even among doctors, very high rates of suicide, triple that of any other profession.
Why is that? What is the...
I mean, I think it's abnormal levels of stress, ongoing, that depletes the body and of its resources, and there's not very much focus on emotional and mental resiliency in training healthcare professionals, so that just goes out the window, and they're left with their own devices. And if they don't have that background already or a good support system, it's so much harder to day in and day out face what they face and to be able to cope with the immense pressures. And so
do you just coach on the sexuality part or on all the different aspects of integrative medicine, the holistic approach?
It's definitely holistic, because I like to give people a practice that they can do every day. So I teach people Qigong morning practice.
What is that? Can you explain?
Qigong is very similar to Tai Chi. They both come from the same root. So it's a gentle movement meditation that originated in China many hundreds of years ago. And it's a way to calm the nervous system, to recycle what they would call qi, like our vital energy through the body, and to harmonize everything so that even it nourishes the glands, it helps move the lymph through the body, so eliminating toxins.
So is that a combination of movements and breathing techniques?
Right. Gentle movements and breathing. I teach things that almost anyone can do. I've even taught people who are wheelchair bound, people who can barely move their limbs. So almost anybody can learn it. And because a lot of it is breathing. Just like yoga, it's this breathing. It's an internal practice. So I teach them those kind of things of breathing, movement. I teach them about nutrition also. I teach them different life. I encourage them and coach them along the way to really focus the lens of, if you want to thrive, the sexuality piece is a big part of it. It can't just be left out of the picture. So
I recently had another guest, and he practices kinesiology and teaches that. He does believe that so many illnesses can be just kept at bay just by following that and using one's own energy, and also trying to harness the energy around you. Do you include any of that in your practice?
Definitely. Yeah, I wouldn't call it kinesiology, but I've done somatic movement therapies and trained under many different people to basically connect people to the inward experience of their body. So modern medicine is very much about the external body and looking at the body kind of like a sum of parts. But the movement therapies, somatic movement therapy, is about feeling and connecting inward and being more in tune, and then being aware of, oh, what is my body telling me? What do I need to do?
I see.
And so I teach people kind of a whole gamut of ways to become healthier, to feel a lot more vital, to have more pleasure in their lives, and to shift the frame of stress into flow. So instead of focusing on stress, focusing on ease and flow.
Where does the current healthcare system come, when it covers the normal medical treatments? Does it also cover these?
It's not that common that they cover. I don't think
they do not.
I don't think it really. I tried to bill insurance for my clients under yoga therapy because that's the closest thing to what I do.
I see.
But it's still kind of a push and pull. Some people can get it reimbursed through their flexible spending account and so forth.
See.
But in general, it doesn't fit into one category, so it's harder to...
So it's not really accepted as a main medical treatment.
No.
I'm saying this because initially it was just the allopathic medicine and the current medical system that you call. And they already found out that it's lacking in so many ways in terms of post-surgical recovery, in terms of people that have mental problems. Most of them do not ever get better, or maybe they're just the symptoms are controlled, but they're not completely cured ever. And then people have already started to figure out that these alternative modalities that you're calling, that you're mentioning, they are more effective in really helping a person to recover completely and to completely be cured, right?
I hope so. I mean, not in every case, but
but I guess
sometimes it's a combination of conventional medicine and integrative. Everyone's different, but
exactly. Integrative medicine, all these alternative medicines, they may or may not be completely curing someone. They'll have to work with the allopathic medical field. I'm just wondering whether yourself and other practitioners like you are keeping good records so this can form some kind of a medical study.
I know a lot of people in this kind of world, in the alternative healing world, and there are so many new studies coming out about herbs and acupuncture and energy medicine and so forth. So it's encouraging to see because there are people putting serious effort into that. It's not my particular passion to be a researcher and to create studies, but I do absolutely see the value in it.
Nowadays with online access, anybody is posting anything, touting this herb and that herb, and they're not really scientifically tested. Again, anyone with or without the background, with or without the specialized knowledge, they also post anything they like online. So there's just no way to find out what is really tried and tested versus just somebody's opinion, just somebody's suggestion, right?
It's a wild world, I know. Well, I find, too, there are studies that are very biased. So even if you have what seems to be a rigorous study, there can be, vested interests and payoffs and so forth. So you don't always know. Yes, it's true. It's hard to tell what is tried and true and authentic. But I do think there are certain. I think ultimately I try to help people to trust their body and to trust the wisdom of their body.
Tell us a little bit more about your experience trying to convince the people that you're trying to help that sexuality helps in helping with their health.
Well, I try not to convince anybody. I like to inspire people. I like to, what's the main reason I did the Sex and Medicine Summit was to give people other perspectives.
Okay.
And to give them a library, essentially, that they could refer to anytime and learn information that's not that easy to find in one place. Okay. And it may be the first of its kind in that way, to give people grounded information from experts who have lots of years of experience, who have research behind them, and to have the compassion as well, because I find there can be so much burnout in the healthcare system. People are overloaded with patient caseloads, but no one wants to feel like just another number, another chart being closed. They want to feel like a person that's cared for. So I definitely advise people to be their own best ally, be your own best doctor. Not that you don't need a physician, but to learn and study your body, be curious, find out, with sexuality in particular. Be curious and open, make yourself available to pleasure, because pleasure heals. There's something like 238 health benefits to an orgasm. 238 benefits. Immune system function goes up, the endocrine system function, there's so many things.
Yeah, so many chemicals are made in the body as a response to it, right?
Right, dopamine is released in the brain, there's endorphins that flood through the body.
You can sleep well.
You can sleep well.
Insomnia, that way.
People with chronic pain, there's a whole interview I did about that with people with disabilities and chronic pain. Engaging at that level with a partner, even alone, can be so healing. It can take the person completely out of their pain mode, the setting, their default setting, where they feel pain all the time and depression, that accessing pleasure is actually a wonderful way to naturally address a situation like that.
Can you give a little example where, to describe some situation that you recently, handled?
I like to share an example that one of my colleagues shared with me, because I think it's a perfect example. Well, if there's time to do two.
You only have like 2 minutes.
Oh, okay. Well, I'll share. I used to teach a movement and belly dance class for women at the hospital who had disabilities. And they would always say at the end of the class, this is the only hour of my week that I'm not aware of pain, that I feel like a woman again, and I feel full of life. I don't think about my medication, I don't think about my treatment, I just feel alive, and I don't think about pain. So for that 1 hour that they were moving and I was guiding them through into their bodies, into a meditative space that's also sensual, they were coming more to life. They didn't feel like a patient anymore. And I think that's extremely valuable for them. They still call me, they still ask, when are you coming back to the hospital? So I know it made a big difference.
I think that makes, that's a very good story and gives a lot of hope to everyone else who is in pain or is in some kind of a medical treatment and they don't want to feel pain. We only have about a minute left. So what we will do is in the next show, we'll go more in depth about your experiences holding the summit and getting all these other doctors and medical professionals. And let's discuss about what you heard from those folks. Thank you very much,
Thank you.
Anita. That was Anita Boeninger. I hope you enjoyed the show, and if you have any questions or comments, please write to practicaltalktime@yahoo.com. So please also tune back in next week to watch part 2 of the show. Until next time, goodbye.